Welcome back to Breaking the Chains. In episode 9, we're focusing on a crucial topic, the treatments of addiction. We'll explore different approaches, from therapy and medication to emerging scientific breakthroughs. Whether you're looking to understand treatment options or simply curious about the science behind recovery, this episode will shed light on the paths to overcoming addiction. Let's break it down.
Okay, so welcome back everyone for another deep dive.
Yeah.
Today,
Looking forward to this one.
it's a big one.
Absolutely.
Addiction treatment. So much to talk about.
Yeah.
We're really going to try to
Get into it.
get into it, not just, skim the surface. Like, what is addiction? That we all kind of know that at this point.
We're past that.
Yeah.
For sure.
So we're using pasted text
What?
as our
Guide.
Yeah, or our source material. And I think it was really interesting. One of the things that really stood out to me was this whole idea of motivational interviewing.
Oh, yeah. That's
Have you...
fascinating.
Yeah, it is.
Have you seen that, in action?
Definitely. Yeah, I mean, it's becoming more and more popular as a therapeutic approach.
So explain it to me. Okay, so imagine, someone who's struggling with addiction and they're not quite ready to make a change.
Right.
And instead of, kind of lecturing them or telling them what to do,
Which never works.
right?
Yeah.
You're almost like a gentle guide,
Yeah.
You're helping them to explore their own ambivalence, their own, pros and cons of changing.
Yeah.
And ultimately, the goal is to help them find their own intrinsic motivation. That spark inside that says, I want to do this for myself.
It's kind of like that old saying.
Yeah.
You can lead a horse to water, but...
But you can't make it drink.
Exactly.
Right.
So...
You can make them thirsty, though.
Oh, that's a good one.
Right. That's what motivational interviewing is all about.
Okay, so you're making them thirsty for
change. Exactly.
By showing them what are the good things that could happen
Exactly.
if you made this change?
What's important to you? What are your values?
Yeah.
How does this behavior conflict with those values?
Right.
And helping them to kind of come to that realization on their own.
That's powerful.
It is. It's much more effective than the old kind of authoritarian approach.
Yeah, for sure.
Right.
Okay, so another thing that Pasted Text talks a lot about is CBT.
Oh, yeah.
Cognitive behavioral therapy.
Cognitive behavioral therapy.
It's kind of everyone's talking about it.
It's like a buzzword.
It is.
But how does it actually...
How does it work?
Work for addiction specifically.
Yeah. So CBT is really about helping people to identify and change those negative thought patterns and behaviors that are so often intertwined with addiction.
Yeah.
So, you might have someone who's, struggling with cravings and they have this automatic thought oh, I can't resist this.
Yeah.
I have to use
I need this. Right.
And so CBT helps them to kind of step back.
Okay.
And challenge that thought.
Is that really true?
Yeah.
Is there another way of looking at this situation?
Right.
And then it also helps them to develop coping mechanisms.
Okay.
So, if they're having a craving, what can they do instead of using? Can they call a friend? Can they go for a walk? Can they, engage in some other activity that will help them to ride out that urge?
So there are actual techniques.
Oh, yeah. Tons of techniques.
Okay.
What's an example?
So one that I think is particularly helpful for addiction is called urge surfing.
Urge surfing.
Urge surfing.
Okay.
Have you ever heard of that?
I have not.
So it's this idea that instead of trying to suppress the craving, you actually kind of lean into it.
Okay.
You observe it, you acknowledge it, you ride it out like a wave.
Interesting.
Because cravings, they come and go.
Yeah.
They're like waves, they crest, and then they break.
So you don't have to...
You don't get swept away by them.
Be controlled by it.
Exactly.
You can just kind of notice it. Oh, there's that craving again.
Okay.
Interesting.
That's fascinating.
Yeah, and then you just let it pass.
Okay.
And it's amazing how effective that can be.
Wow.
Yeah.
Okay, so we talked about the behavioral side of things.
Right.
CBT, motivational interviewing. But what about medication?
The biological piece.
Yeah. That's a huge part of addiction treatment.
Absolutely. A lot of controversy too.
Yeah, for sure.
Around medication.
So Pasted Text mentions methadone.
Yeah.
And honestly, I was reading about it and I was like, I don't really know
how it works.
Yeah, how it works. I've always kind of
Heard of it.
Yeah. But like, what is it actually doing?
Yeah, so it's all about the opioid receptors in the brain.
Okay.
You see, methadone acts as a substitute opioid.
Okay.
So it binds to those same receptors that drugs like heroin or oxycodone would bind to.
Right.
But it does so in a way that reduces cravings and withdrawal symptoms without producing that intense euphoric effect.
Right.
So you're not
Getting high.
getting high. You're just
Right.
kind of leveling out.
Yeah, taking the edge off.
Taking the edge off.
Exactly. And that allows individuals to stabilize their lives,
Yeah,
get back on track,
right.
address the psychological aspects of recovery.
So it's like giving your brain a break.
It is. It's like hitting the pause button
Yeah.
on the chaos.
Yeah, okay.
Right. And it's important to note that methadone interacts primarily with the mu opioid receptor,
Okay.
which plays a key role in pain relief and addiction.
Oh.
And other opioids like fentanyl, for example,
Okay.
have a much higher affinity for this receptor,
So that's why
which is why they're so much more potent
they're so dangerous.
and dangerous.
Okay,
Exactly.
that makes sense.
Yeah.
Okay, so pasted text also mentions naltrexone
Yeah.
as a medication for addiction treatment.
Mhm.
How does that one work?
So naltrexone takes a different approach.
Okay. Instead of activating those opioid receptors,
Right.
it actually blocks them.
Oh, wow.
So if someone were to use opioids while on naltrexone,
Yeah.
they wouldn't experience those pleasurable effects.
Oh, wow.
Right, so it's kind of like
So it's like taking away the
taking away the reward. Yeah.
Exactly.
Okay, so it's not giving you anything, it's
Yeah.
just blocking.
It's just blocking the effects.
Okay.
And that can significantly reduce the desire to use
Makes sense.
and the risk of relapse.
Okay.
Yeah.
So last but not least,
Yeah.
we have to talk about
The big picture.
the big picture.
Yeah.
Holistic treatment.
Right. It's not just about
It's not just about
the substance.
It's about the whole person.
the whole person. Yeah.
Right.
So pasted text really emphasizes mindfulness.
Mindfulness, yeah,
Yeah.
big one.
Okay.
So mindfulness practices can be incredibly powerful in helping people to become more aware of their thoughts,
Yeah.
their feelings, their bodily sensations.
Right. And this can be really helpful in managing cravings and stress.
So you're kind of
Tuning
in.
to yourself.
Yeah.
Becoming more present.
Okay.
And that can help to break those automatic patterns
Right.
that can lead to relapse.
Because I was reading pasted text also.
Yeah.
That exercise
Oh, exercise. Yeah.
like can help rewire.
Yeah.
It's a brain.
It's a brain.
It is.
That's wild.
So exercise releases endorphins,
Right.
which have mood boosting effects.
Right.
And can help to combat the depression and anxiety that so often accompany addiction.
Right.
And regular physical activity can also improve sleep, reduce stress, increase self-esteem,
Right.
all of which contribute to long-term recovery.
So you're basically like
Building yourself up.
building yourself up.
Yeah.
Yeah, like rebuilding.
Creating a foundation of well-being.
Okay.
Yeah.
It's like
Brick by brick.
brick by brick.
Right.
So we've talked about a lot,
In-depth approaches. Yeah.
but I think
What's clear is that
it's clear that there's no
magic bullet.
magic bullet
Right.
when it comes to addiction treatment.
It's not one size fits all.
Yeah.
Everyone's different.
Pasted text talks about how you need an individualized.
Individualized treatment plan.
Yeah, absolutely.
That's so important.
It is.
Okay, and that's why
Professional help.
professional help is so
It's essential.
essential.
Yeah.
Yeah.
A qualified healthcare provider can help to navigate the complexities of addiction
Yeah.
and guide the individual towards the most appropriate treatment approach.
Okay. So we've covered a lot of ground today.
A lot.
But here's one final thought
Okay.
to chew on.
I like it.
If you were to design
Yeah.
a brand new addiction treatment program,
Okay.
what would be the core elements?
The non-negotiables.
The non-negotiables, yeah. Interesting.
What would they be?
What would they be?
And why?
Yeah.
Keep that in mind as you continue your
Your
deep dive
Yeah.
into this topic.
important topic.
It is.
Absolutely.
That's okay. Until next time.
See you then.
Bye.
Bye.
Don't forget to like, subscribe, and turn on your notification bell for more.